morning, everybody. Excellent. I'm Jim Nasser. I'm with Art Media, and welcome to Drupal Camp 2013. I think it's one of those situations where it's a mixed blessing. We get the 10:10 time slot, which is good. You guys are still raring to go, but it's a mile and a half away from the rest of the crowd, so hopefully you found it okay. So today we're going to, myself and Dimitri, my colleague, we're going to talk about really Drupal and Alfresco in one integrated solution. We have a healthcare case management solution that we built based on some requirements that we've had from clients, and we have quite a focus on health IT, so it's really part of our business practice. But the solution really is to kind of show some of the key features of integrating these two products together, and hopefully some more details about the industry as well. Alright, looks like we're ready now. So myself and Dimi here, going to be working through this with yourselves. So as you guys all know, obviously right now healthcare is very, very in the news for lots of reasons. Some of which good, some of which not so good. Just to give you a flavor in this first part, just a little background, I guess, like not so much background, but just some trends, things that are happening right now in the industry. It's fair to say it's very complicated. It's hot, but it's sometimes hot not in a really good way because people don't really know what's going on as consumers or even as providers, payers, physicians. There are four major stakeholders in the mix, and it's a very complicated picture. So some of the reasons why it's complicated, well, all of us have heard about Obamacare. It's kind of the Affordable Health Act. It's in, but it's not really in, and people don't really know, exactly what the impact is. Small businesses, individuals are impacted. It's come in, but isn't necessarily fully there. And I think there's still a lot to be resolved around that. And anyway, the website, just as you notice, is supposed to be up, but it's not really up. One other, there are several other factors. Another major factor is what's called ICD-10. ICD-10, is anybody familiar with that? Okay, good. So some of you guys come from the health IT background. So it's really a major kind of initiative in basically recoding, health and medical procedures and health diseases, and these need to be adopted by physicians, by electronic medical record systems, electronic health record systems, and really the entire ecosystem. And this is due next October 1st. We're all supposed to be compliant to this. And again, it's a major initiative, and it's impacting everybody. And it's fair to say again that who knows if people are going to be compliant, in about a year from now. But there's a lot of attention on this. Just the other day, we had one of the leaders at the CDC talk about this and what they're doing at the CDC to try and educate or transition the rest of the federal government into ICD-10 and educate state and local governments. So, hopefully it'll happen, but it's definitely happening. It's definitely a requirement. Another kind of key requirement is what's called meaningful use 2. And this is really kind of the second stage of meaningful use, I guess for obvious reasons. But the implication of this really is that, again, physicians, providers, really have to go by 2014, by October 2014, they need to be compliant for use of electronic health records, for managing the records. And again, this is not it may sound simple, but it's not. The whole space is very complicated, and there are a lot of different competing technologies and competing interests within the stakeholders. So, but it's happening, and it's actually quite a bit of, if you read the industry, there's quite a bit of, fighting about it. People are not necessarily all kind of on the same page about this, or quite ready yet. Other things that are happening, again, this I think is very familiar to all of us. I think the last 17 days of the government shutdown made it pretty apparent. So mine is too tight to mention. I think what's kind of scary for us in the U.S. is that I think right now the numbers are that the healthcare cost is about 1/5 of the overall GDP for the United States. That's an incredibly high healthcare cost. If you think about it, and if you dissect it even more, Medicare, Medicaid, particularly for older folks and people with kind of either terminal or very kind of chronic diseases, that's the majority of that cost. So it's not a good trend. It's a trend that I think it certainly impacts every one of us individually here, but it also really impacts, going back to kind of the germane point here, is that we have to be a lot more efficient in dealing with healthcare. In the quality of healthcare, administrating it, billing it, systems that manage it, which is good news for folks like us. I'm assuming everybody here is somehow involved in technology. Is that correct? Yeah, so it's good news for us because we can help hopefully fix it, or at least try and address it a little bit. But it's not really good news for the country. There's a lot of money is spent on that, and I think the ever-increasing and never-ending deficit, I think is certainly an indicator of how much of a problem this is too. So moving on, mobility. Mobility is a word. I think if you look at the trends in healthcare usage, using mobile devices, whether it's an iPad or kind of a custom-tailored mobile device, tablet of various kinds, is very, very big, very relevant. Here's some numbers for you. I've got this from a report from CW. Essentially, the doctors, physicians are way more likely than the general population to have tablets. Their job requires them to have mobile access. Walk from patient to patient or hospital or clinic to clinic. So it's very relevant to them. And also, the organizations themselves, hospitals, clinics, practices, have been embracing this. So why this is relevant to us in this conversation is this. So you can argue that there have been EMRs and EHRs around for many, many years. It's nothing new, right? These things have been around. However, they were never developed, they were never built for mobility in mind, right? And where we are going also with some other factors in healthcare, reducing costs, much more about a requirement of electronic health records management. These systems weren't necessarily built for that, they're legacy systems. So there's a window to do some things around this, work with them, not replace them necessarily, and work with an Epic or Centricity and other tools, but bring in some new technologies. And for those of us here who do Drupal, maybe it's a front end, maybe it's a usability angle, and time to legacy backend. There are lots of factors. Another one that I don't want to sort of spend the entire time talking about, but one of the key ones is this idea of personalized health monitoring, health management. From simple things like the Nike Fuel, where everything I'm doing, hey, you barely walked all day, but it's recorded, the data is analyzed, or it's analyzable, to really even very sophisticated DNA tests that you could do with your physician, that then leads to specific selection of medicine that's applicable, safe, effective, and useful for you. Right, those things are happening. Here's an example from WellDoc. And again, you can kind of see the life cycle here, which is very interesting. This idea of a personalized coach using mobile devices that basically kind of in real time figure out what you're up to, what your nutrition's about, things like that. Tying into analytics. Analytics being at the EMR or the EHR or the content management system, tie that plus other information, maybe not information necessarily like you, but the trends in there, and then tie it to also social management, right? That's another key kind of trend these days. And all of this eventually ties into a kind of an automated expert system that helps you have your personalized medical management program. So these are happening right now. And again, the good news for us is that these technologies, a lot of them are things that we do. We just don't do them in the context of healthcare yet, but they're needed. But the other good thing is that most of the typical healthcare organizations, they don't do these things in the context of usable, consumer-facing products. So that's where I think there's a nice overlap. So just a little background about kind of what's going on in the industry. I don't want to spend too much time here. I think most of us probably are familiar with these things. But kind of specifically, really, why content management and healthcare? Because some of those things we talk about are general, more macro patterns and macro kind of activities, and then specific to content. But I think, and we think, and we've seen a lot of evidence that content management, enterprise content management, is really kind of a great, or not just great, a critical facilitator for this future vision, right? So I'll give you some examples. So healthcare content, unlike 10, 20 years ago, where it was primarily, big images stored in files, as well as records, in a database or Excel spreadsheet, things like that. Now it is highly unstructured content. Images are electronic. Your X-ray, it's no longer film. It's electronic. It's tied to your either pictures that have been taken, or documents that have been written. They're all electronic, or documents, PDFs, whatever. It's tied to your billing information. It's tied to your credentials. It's tied to your insurance policy. Most of this information is unstructured. And enterprise content management is all about managing unstructured content. So right there, I think you have a great facilitator for this space. Let's see, information sharing is very, very critical to increase productivity. Again, going back to a picture about the healthcare costs being about 18% of the GDP, actually it's closer to 20% these days, right? So we have to be more productive in managing it, right? We just can't be this. So information sharing across not just doctors, but across different critical stakeholders, physicians, with patients, with insurance providers, right? With government agencies that provide like the ICD-10 groups and things like that. That kind of interaction is very, very important, and that's where meaningful use 2 and the health information exchange and things like that are going to. And all of these things are kind of coming together in one crescendo. And then related to this idea that healthcare is all about saving lives, proactively making us healthier, and preventing issues, particularly chronic issues, things that become very, very costly. So managing or sharing knowledge is really important. It's not just important, it's very timely. It's got to be done almost instantaneously in cases. If somebody has a new drug or a new procedure or whatever that's going to help an existing condition, people need to know about it quickly as soon as it's approved. So that's a key part of it. And many of these things, by the way, were not necessarily part of the traditional, EMR, EHR agenda, right? Those systems that were built, this kind of information sharing across 4 different constituents, that was not part of the deal. Most of these EMRs doing customer self-service, so somebody could go with your iPad and check on their, what are the symptoms of my problem in a secure manner. What did my insurance say? What insurance, going back to ICD-10, what insurance codes were approved, things like that. None of that was part of the picture. It is part of the picture now. And that's why there's an opportunity, right? As I mentioned, there are lots of existing and emerging standards. It's get more and more complicated. These standards are very, very, very difficult for physicians in particular, and patients to understand and deal with. So really the effective way is for them to be embedded in systems, and in those systems to be easy to use, right? Because if the systems are very difficult to use, then you might as well, it doesn't really make a difference if you put those standards in there or not. And then going back to this whole idea of multiple, you may have heard of the one record or the longitudinal record for patient care. So that's really the idea of an aggregated view of content, right? So it doesn't matter how many repositories you have. It could be you could have your electronic medical records repository. You could have your content management. You could have your billing system in Oracle Financials or whatever. It's the idea that you have one aggregated view. And by the way, what is not possible and completely naive is to say, well, we'll put everything into one system. I mean, that's just crazy. That will never happen. And anybody who says that's the direction to go, I think that they're being extremely kind of foolish. Or their vendor, would think that they have a solution for everything. But I think we kind of live in the world that best practice is that you integrate the best products, the best of breed products, and then you use standards for having these systems talk to each other, not like one gigantic system that supposedly does everything. All right, moving on. A really, really key feature, it's actually it's one that's not in play just yet. And in fact, we're working on it, our team and some other of our partners, this idea of a federated search. So this federated search goes back to aggregated view, which means that if you do a search, just like in Google, right? If you go in Google, you do a search for, I don't know, electronic medical records. It'll retrieve information from billions of websites, news, etc., etc. But if you look in an enterprise, right? If you're on SharePoint, for instance, when you do a search, would you be able to retrieve information from your documentum system, or Alfresco, or even email exchange? And I think the answer for most of us is no. Can anybody do that right now? Can any of you guys do federated search?
What is a federated search?
Yeah, it's this idea that you can from one place you can search across multiple repositories. Right? So yeah, probably not, and it's a real issue because unless you can do federated search, it's very, very difficult to pull off this idea of doing kind of productive and efficient content managing medical records and managing aggregated views. Other things that kind of maybe self-explanatory. When you have all these different systems and processes, you really need to have an enterprise workflow to tie them together, and not just systems, but about also people, right? Because these processes are about people doing things and having, and particularly in the medical world, having quality around it. So if somebody signs off on documentation for a drug that's going to go to the FDA for approval, we need to make sure that person, one, was authorized to do it, and two, actually did it, read it, did it, right? That's where kind of workflow and electronic signatures, things like that come into play. And then last but not least, and I think this is where hopefully it's back to our audience here, is that it's not just the back end. The back end is really the plumbing. The thing that makes it useful is the usability, right? And what we've seen with enterprise content management is that the single most important factor in adoption is usability. You could have all the features in the world, you could have you could have the most open system. If it's not usable, nobody will use it, therefore it's a failure. So, and that's where I think Drupal comes in, right? That's where the whole Drupal angle is very, very important because that is a product you can use for consumer consumption, make it easy to use, use responsive design, do native apps on various mobile devices, make that content usable. So what does ECM provide specifically? There are lots of things, but these are the items that kind of came to my mind readily. This idea of a case-centric collaboration. So most medical situations, when you go in there, there's a case. So it's, hey, it's Jim Nash here. Here's a particular case on his broken elbow, right? But then there's information there from the nurse, from like myself, from insurance, from the doctors, and the post-treatment. So it's not disjointed documents, all documents within the case, and they're all tied to me as the patient. And this idea of case collaboration is very, very important. And then once it comes to the payer side, the insurance side, again, very important, right? Because you have to track, going back to ICD-10, you have to track the codes. Hey, the Jim, would his policy have approved him getting this particular treatment, or how much deductible, how much out of pocket, etc. Right? So all of that is the kind of convoluted and is tied to your case collaboration. Imaging and input management, I think is fairly explanatory. Whether it's imaging paper documents or dealing with e-forms for processing claims requests or queries from patients, things like that. I think I talked about this quality management, particularly for documents. It's very, very important to make sure that everything that we say we do, we actually do, and it's in the right way. Records management really is kind of critical in most compliance-oriented arenas. But certainly here too, that medical records or administrative records are kept for a certain amount of time in a certain way, they're disposed in the right manner. So if somebody comes and does e-discovery on you, you can be compliant. And as soon as you don't need to be compliant, you dispose of records that they get you in trouble. This idea of security at the object level, very, very important, right? It's not just saying, well, we're going to give this doctor access to all of Jim's records. It's like, no, he's only going to have access to this specific set of records because, it's not relevant for him, what kind of precondition I had, when I was, doing something else that's not related to this particular, surgery or whatever, right? This idea of kind of object-based security is very important, and not one that's typically provided, at that level of granular manner for, kind of legacy systems. Workflow, we talk about that quite a bit, and web content management, I think it's very self-explanatory for the consumer. And then this idea of kind of ability to content to publish to mobile channels. So a little bit more on input management. In fact, the demo we're going to do shortly in our healthcare case management kind of product is around input management, specifically e-forms. So, obviously there's paper documents, storing them, classifying them, indexing them, ultimately retrieval to search, archival, and then this idea of electronic form processing, invoice management. These days, that's going back to the comment about being productive. That's how you become productive. If you can tie your procedure that the doctor did right into your billing system, right? Because right now it's extremely inefficient. Get the whole cycle from the procedure to insurance to billing back to the patient. There is, literally, tens of billions of dollars wasted in that cycle. Right. Analysis and reporting on process content. This really goes back to this idea of, I mentioned the personalized health monitoring. It's the more content you have, if you can analyze it and have relevant and kind of useful reporting, the more valuable it's going to be, and as part of the input management, particularly on the back end. Integration with various systems, EMR, HR, CRM, you name it. Workflow, we talked about that, and then certainly very, very critical. If all these things, if meaningful use too says you need to use electronic health record management systems, then you need to be able to do electronic signatures, right? It makes no sense to use EHR, then print it on a piece of paper and sign it, right? That breaks the whole cycle. A little bit more about the kind of document quality management in more detail. Again, most of this self-explanatory, I already kind of talked about it. Searching the knowledge base, workflows, electronic sign-offs, idea of automated notification of changes, which is very important, particularly if it's change around your insurance policy. So imagine if you're a hospital, right? It's very important for the hospital to know if there's been a change in my insurance policy before they take on the surgery, and then we're in no man's land, right? Hey, I'm not covered. I wasn't going to pay for it. Insurance not going to pay. Those kind of things become real issues. Records management, archival. I think most of this I already kind of talked about, and it's self-explanatory a little bit. But one of the other kind of key things with this is the idea that you can, within the same system, you can view those images. You can view, you can view your X-ray, you can view your various associated images. All right, audit trails of reporting and retention and deletion. So real quick, before we get to demo, I'm going to kind of just give you a couple of slides on really why Alfresco and Drupal, right here. Anybody familiar with Alfresco here? Okay, good. 2 or 3 people. So Alfresco is really an enterprise content management system. It's an open source system. It's at least to us, for sure, it's the leading open source system for enterprise content management. It competes with products such as Documentum, SharePoint, OpenText, you name it. And the reason why we like it is that it provides really all the scalability and all the kind of rigor that you would expect in enterprise content management, right? And then Drupal, everybody here familiar with Drupal? Yeah, right. So it's a Drupal conference. So when you tie them together, you kind of get the best of both worlds, in our opinion, for these kind of problems. Not for everything, right? If you're doing a marketing website, chances are you don't need to have Alfresco, because you're not going to necessarily have records management. You're not going to have audit trails. You may not have some of the things that, or enterprise workflow and rules engine, things like that we need in this kind of scenario, but you may not need for other scenarios. So as you can see, that's why we've tied them together. Drupal really is our front end. It's for web content management. And then we built the repositories, Alfresco, at the back end, and on top of, and they're really on top of our infrastructure, which is the database as well as our cloud infrastructure. All right, moving on. Alfresco in context, just for those of you guys who may not be familiar, Alfresco works with a number of different products. It works on the cloud. It's got a hybrid solution. Most of these products are probably very familiar with you all. And you see here, it's Drupal, right? That's web content management. And anybody from Acquia here? So they're also working very closely with Alfresco right now on additional Alfresco Drupal solutions, or Drupal Alfresco solutions. So, that I think it's a direction that makes sense, just because Anybody here attended the DrupalCon in Portland? All right. So one of the key messages that was I guess relayed there by Breeze was this idea that we don't want to be Adobe CQ5. We don't want to be Cycle. We don't want to be the product that kind of says or claims that it does everything. That we do marketing automation and we do CRM, et cetera, et cetera. We want to be the best that we are in the web content management space. But we want to integrate with the best breed in other areas, such as Alfresco. So I don't think this is going to be a story that's going to go away. I think this is something that hopefully you hear more and more. Just real quick, this is how these things look. In our scenario, we have Joe as a patient interacting with an insurance company, and there's various folks there. All the consumer activities are through Drupal. All the back end is in Alfresco. And then the connection between these two is through this protocol called CMIS, which is the Content Management Interoperability Services, an API that's managed by Oasis. So we really like that because it's open source and it's managed independent of specific vendors. So if you build code to that standard, that's not going to just go away because a particular vendor chose, I don't want to support it anymore. All right, and then here's the bigger picture. I'm not going to go through all this. This is just kind of showing you that if you're thinking about healthcare case management, there's way more to it than just the repository and web content management. There's a whole imaging piece here. There's migration of content there. There's document management and collaboration here. There's records management here. There's reporting here, right? There's federated search here. There's a lot more to the solution than just a repository web content management. Obviously, for today, we're not going to go through all this stuff. This is something that we've kind of been building, in our R&D labs for a while, and also have built a similar solution for open government. But the solution is much bigger than just two tools working together. Right? All right. And now I'm going to introduce my colleague, Jimmy Geno. He's going to come in and going to walk through this healthcare use case on our demo product.
Thanks, Jim. Hey, everybody. So before I jump in, I would just ask, just stretch your arms just a little bit, right? And just relax. But are all of you building Drupal websites and you're looking to build them for hospitals, doctors, or clinics? Who are you guys looking to build the Drupal sites for? Government agencies? Insurance? Vendor? Enterprise. All right, great. So right now, when I think about Drupal, when I look at Drupal, Drupal is very powerful. We love Drupal. We also love Alfresco. But since all of you are somewhat in the business of building Drupal sites, what if you can take your Drupal site and go way beyond just responsiveness, way beyond contextual awareness, way beyond just having a very sexy Drupal site, right? But being able to sell your clients a bit more. So rather than just saying we can just build your website for you, but we can. Jim mentioned earlier this notion of search. So let's say that for a government agency, you build a Drupal site, or for an insurance company, you build a Drupal site. But is the site a simple portfolio site that just shows marketing data, or does it truly reflect? So from your Drupal site, can you search an insurance database? Can you run reports and show that on the Drupal site the kind of data that lives inside of the enterprise and reflect that to the insurer's customers?
That's what we want to do.
Beautiful. All right, so at the end of this time, I'm going to walk you through one way of doing it. Jim mentioned this notion of integrating with Alfresco. You can integrate with pretty much anything, but the whole idea is taking Drupal past it being just a simple like WCM website sort of feel and sort of taking the data that lives within that company and moving it upwards to your customers to make the website a lot more engaging, a lot more just informative. Make sense?
Yes.
Great. Beautiful. All right, so that's what I want to sort of walk you through. I was looking at your faces and just trying to gauge what are you guys here for? Like, what do you want to hear? So right now I'm going to walk you through one way of doing it. So we've taken a Drupal website, and you guys are much better at building Drupal sites than we are. But what we are really good at is connecting Drupal sites to a lot of backend systems, and then exposing that data out towards your users. Okay? All right, let's rock and roll. So for this particular use case, we're using a healthcare company. It's rather an insurance company who's the provider. They actually pay, it could be Aetna, Blue Cross Blue Shield, etc. All right? They have all of this data in the back end, but they want to engage their customers because they want to sell more healthcare, basically, coverage. All right? So what they'll do is a patient goes to a doctor's office and he has a herniated disc. This is a chronic ailment, and the doctor says, your insurance will not cover you. And Joe says, I'm not sure about that. So he goes to either Aetna's site or Blue Cross Blue Shield site, and he submits an inquiry, right? But Joe, that inquiry can take a long time for someone to respond to it. So Joe wants to see some contextual information. Where is this inquiry in the process of it being answered, right? I want to know, as Joe, where are we? Like, are you done answering my question? Are you in the middle of the process, right? And not only that, Joe also wants to be able to see the associated documents that the insurance agent sort of prepared for him, right? So we want to surface that into a Drupal site, but in reality, all of the back-end work from an insurance agency perspective is happening in the background using their own internal systems, not Drupal. Okay, so we want to connect the two so that way Joe has a much more engaging experience. Does that make sense? And is that sort of the thing that you guys are looking to accomplish? I know this gentleman is. All right, beautiful. So let's rock and roll. So essentially, I walked you through what we're going to see. I'm going to now go for it. Okay. So if you take a look here, this is a Drupal site that one of you guys built. All right, where you have this portal. It's for an insurance company, and now you want to engage Joe. So Joe comes on this site, he sees it's responsive, he can go on his mobile app, he can do all of that fun stuff he can do with Drupal, but he wants to now engage with the agency. Right, so what he's going to do is submit an inquiry. Right, so by clicking on this button, we take you to a Drupal form, and you guys can probably create a whole lot nicer form than I can, but essentially it's a form. And within this form, he's going to submit information, a request to an agent who's going to receive an email, right? Letting him know, hey, someone just submitted a request, start processing it using your case management system, or using your CRM system, or using your EMR system, or whatever backend system that you have, all right? All right, bear with me as I fill this information. Am I covered? Please let me know. Okay, and remember, he's checking to see whether his policy covers a herniated disc ailment or. Okay, he's going to submit this query. So this query will move from Drupal, right, into their back-end systems. Right, so Drupal doesn't really have that kind of visibility. You don't want Drupal to have that kind of visibility. You want Drupal just to engage the user and provide feedback to the user based on the information from the backend system. So here, I'm just going to wait for my emails to come through. So at this point, once my emails come through, Joe is going to get an email letting him know, hey, Joe, we received your request. Don't worry, we're on it. And then the analyst, Frank, is also going to get an email saying, Frank, check this out. Joe just sent your request. Start processing it using whatever backend system that you have at your company. All right? So here's the request that Frank received. So Frank simply clicks on the link. Okay, and I'm going to log in. So this is a backend system. The backend system that we chose to integrate with is Alfresco. We're a big fan of Alfresco as we are a big fan of Drupal. But you can integrate with whatever backend system your client has. Okay? So I'll log in. And once I log in, you'll see that we've taken information from Drupal, so from the edge, from that patient, and we've ingested it into that backend system. And within this backend system, we've automatically created an inquiry folder. So this could be a case in a case management system. This could be an entry in your CRM system. it's up to whatever backend system that you have. In addition, notice that we've captured the metadata from your Drupal form, and we've stored it into your backend system. All right, so perhaps if we have time, I can sort of walk you through what are the different ways that we can do that, or you can do that. And Jen mentioned one way, and that's using the CMIS connector, the CMIS connector, which is essentially a standard way of having different repositories communicate. And Drupal is really good at supporting that protocol. Okay? So at this time, I'm going to start walking through the process of Frank, who's the analyst, of what he would do with this sort of back-end case management system that we happen to use Alfresco for. All right? Because Alfresco is a great platform for doing that sort of thing. So at this time, let me fix this. I'm simply going to search Joe for Joe the patient. What if your Drupal site can also search for this kind of information? Which Jim mentioned earlier about this notion of federated search. So rather than Drupal just searching for articles in Drupal, right? What if you can make your sites a lot more powerful, right? So then you can go to your clients and say, hey client, not only can we create a nice site for you, but we can really give your customers an engaging experience, right? So, and of course you can also control what data gets exposed out. You don't want medical records being exposed on a public Drupal site, of course, but you can somewhat control that, okay? So here, notice that as Frank the analyst, I'm in this case management system called Alfresco, and I'm working on this case. So I got the request from Joe who's saying, I want to know whether or not I'm covered, so I can quickly pull up Joe's policy, all right, with a Google-like search, which Alfresco supports, okay? And here, so Frank can review his policy, check to see if it's right, if it supports it, if it's a pre-existing condition, et cetera, et cetera. So at this point, Frank does his analysis, and whatever tool you're using, you can analyze the data, you can redact the data, you can highlight some things, hide some things, you can tweak information. So I'm simply going to say, Frank or Joe, I reviewed your policy, and I agree that it should be covered. Or I'm telling you that it will be covered, and here's why, and here's the line item in your policy that states it. Okay? So as Frank, I'm going to begin to prepare this sort of response to Joe. And here's Joe's inquiry. So I'm going to make a copy of this policy, and what I'm going to do is send that policy out to Drupal. All right? Such that Joe, he doesn't need to have access to this backend system. He can access it from Drupal. But not only that, remember, these backend systems are highly sensitive. They're called backend systems for a reason. There's a lot of security around them. People just don't want this information out there because you can get sued, etc. So it has to go through a workflow process, a process of approving whether or not this information can be published.
Do you want to take questions while you're presenting?
If the question is short, sure. If not, we can wait towards the end.
So what it looks like here is it looks like you send an email to the insurance company, and the insurance company then looks up in his system and then emails it back to Joe, basically. And I don't see interoperability here.
Absolutely. So that's one way of looking at it. So once we take a look at the site, you'll be able to see on the Drupal site that email is just more of a notification thing rather than being the means of exchanging the information. So you'll see that within the email, no information is actually exchanged. Right? You can only go to the secure Drupal portal to access that information, both submitting and also receiving the data. Okay, so let me actually walk you through and show you that. So at this time, I'm Frank. I just prepared my package. I'm ready to go. And Joe, he's going to review. He's going to log back into the site, and he wants to just check the status of his inquiry. All right? He notices that my inquiry is moved from step 1 to step 2, which is a very engaging way for Joe just to know, all right, at least someone's working on this. Just like, at Domino's, when you order that pizza and you're able to see, Sally's putting the toppings on my pizza, Ben is about to deliver it. Like, that's really informative and comforting as a user to know that at least it's not being ignored. All right, so Joe logs into the site and is able to see this process, right? And not only that, once it's completed, Joe will be able to download the documents or whatever set of documents that Frank has prepared. And not only has he prepared, but has gotten approval from his manager. Okay, so at this time, we're going to take the inquiry that we've prepared for Joe, and we're going to request approval, right? Because usually you can't just submit these things publicly, right? And within the Alfresco system, Alfresco supports drag and drop, or many other kinds of features. You can move from one record state to another record state, fully supports records management, stuff like that, okay? And so at this time, by simply dragging and drop that folder to the pending approval folder, what I'm formally doing is requesting approval from my manager, who's going to get an email. I heard the ding, right? Who in the email states, "Hey manager, I prepared this inquiry for Joe. Would you just validate that it's legit, that I didn't make any mistakes before sending it out to Joe?" Okay, so Frank reviews it, or yeah, Frank sends it to his manager, Sally. And I need to actually log out. Okay, it's fine for now. And what Sally would do is simply review it and either approve or reject it, right? And if she approves it, then essentially what happens is the document gets routed, and this is where the integration comes in, to your point. It's routed to Drupal, and there are many ways that you can route it to Drupal. Either you can have Drupal actually store the information, at which point it's a node within Drupal, or you can have that information remain in the backend system. So depending on how you guys want to integrate, and have that information, so Drupal simply has a pointer to another backend system that's web exposable, and then you get that information that way. Okay, so at this time, Sally reviewed it, she approved it, she's good to go. Okay, and notice that if Joe goes back on the site, he'll be able to get a sense that it's completed, and not only is it completed, Joe can go on the website, the secure portal that you guys build, and it'll look a lot sexier than this, but you guys know how to do it, right? And from here, Joe can download the document. Okay, so remember, Joe never once got into the backend system. It's a full integration, and this is one way to integrate. And the whole point of this is being able to move your Drupal products, move your Drupal services beyond just the website piece. The deep integration, regardless of the type of system that you're integrating with. So essentially, this sort of is the cycle. So any questions so far, or any thoughts? I see a lot of blank stares, but yeah, go ahead.
So the keys to this puzzle really is the CMIS.
That is one key.
That's really the basic.
But it's a really good key, a very powerful key.
Protected, but I want to share it with individuals who have the credentials to see that one piece of information.
Yes. Yes. And so there are many other backend systems that support CMIS. SAP supports it, SharePoint supports it, Alfresco Drupal, of course, and Documentum, Oracle, FileNet. So you have a lot of backend systems that support it out of the box. But there may be other systems, right? Like, for example, some EMRs that don't support CMIS. And so you want to find a different way to integrate. But the whole point is that we're making is that you want to take your Drupal sites beyond it being just a portfolio site, right? So that way you can expand your practice, you can build much more richer solutions, etc.
I'm hitting the CMIS question as well, but is CMIS just a model of Drupal, or is it an API that you have to go out there and model yourself?
It's a module, so you can simply download it, and it's a regular as you install it like a regular Drupal module, and then you can point it to another repository and sort of get that information.
And to just build federated searches and things like that through you go through the CMIS, of course, into whatever backend that is that you have. So that's really the key to do things like this. With you guys' system now, how do you guys handle people with disabilities? Like, I know that that's one of the standards, basic type of question. And But when you're building this interoperability, do you have to consider that from your point of view, from your company's
From an accessibility, like 508 compliance.
compliance?
Sure. And that's really going to be on where the user interacts with the system. So if you're talking about 508 from an internal perspective, then the Alfresco system or whatever backend system that you have must be 508. But if it's more from an external consumer perspective, how Joe's interacting with it, that system has to be 508 compliant. I think we have about 3 more minutes.
I mean, just to I'm sorry.
Okay, good.
Just to expand on this, we actually do a lot of work with the federal government. So 508 compliance is one of the key requirements for most of those. Alfresco is 508 compliant. If you're going to use it, the solution we built here, really certainly for the demo purposes, is not there.
Yeah.
However, that's really a kind of requirement that we take, per client situation. But it's a very key requirement pretty much across the board for federal agencies. I mean, it's a law, basically.
Yes.
So,
I understand that. Thank you.
Great. Any other questions? I see the gentleman here.
Just a quick question. You said that you can upload in the data and create a node model in Drupal
Yep.
or point somewhere else. Is there a best practice, or is that something that you all prefer?
I think it really varies per client. Depends on the kind of data, right? But the best practice for us would be to not push it to Drupal. So, but some clients. So, for example, if for example the data that's being pushed is being pushed out publicly, right? Then you don't want to have your backend system fielding 1 million requests per second, right? So you would want to push it either to some caching server or push it to Drupal for delivery, right? But if it's not being hit by gazillion people because it's public and it's really specific to this one person, you may want to have the backend system field it or put some type of layer in between that can field the number of requests. So I think it varies based on your use case and what it is you're trying to accomplish and what the data is and who you're sending it to.
sorry. One other quick comment around this particular use case. Our approach is to have all the content in the Alfresco repository, primarily because of the records management and security requirements. So when, like we do here, when we publish a redacted document, it's really kind of pushed out, but it's not retained in Drupal. We around the time? I think we're probably just about out of time. We appreciate your time. We're going to be around. We're more than happy to talk to you. We have a table somewhere near the food. So come over and see us. We'll be happy to chat with you. And thanks for your time.
Thanks so much.